Welcome to today's lecture on histology. In this session, we will cover an array of fascinating topics related to hematological disorders and their underlying cellular mechanisms. We will explore the intricate processes of hematopoietic stem cell differentiation, bone marrow metastasis in solid tumors, cytogenetic abnormalities in hematological malignancies, molecular genetics and hematological disorders, flow cytometry and immunophenotyping in hematology, evaluation of bone marrow aspirate smear, and the impact of hemoglobinopathies and thalassemias. Moving forward, we will delve into the complexities of myelodysplastic syndromes and secondary leukemias, bone marrow transplantation, hematological manifestations in systemic diseases, hemostasis and coagulation disorders, and the innovative approach of molecular targeted therapy in hematologic cancers. By the end of this lecture, you will have gained insight into these topics and their significance in the field of histology. So, without further ado, let us begin with our first topic. Hematopoietic stem cells, HSCs, are multipotent cells present in the bone marrow and cord blood. They have the remarkable ability to self-renew, thereby providing a continuous supply of new blood cells throughout an individual's lifetime. HSC differentiation is a precisely regulated process involving a series of stages and molecular cues. During differentiation, HSCs undergo a sequence of cell fate decisions, leading to the formation of various lineages of blood cells, including erythrocytes, leukocytes, and platelets. This process is tightly controlled by a network of transcription factors, cytokines, and growth factors. Additionally, HSCs interact with various cellular and extracellular components in the bone marrow microenvironment, known as the hematopoietic niche, which influences their fate. Understanding the mechanisms behind HSC differentiation is crucial for developing therapeutic strategies to treat hematological disorders. By deciphering the factors that promote or hinder differentiation and identifying abnormal patterns, researchers can propose targeted interventions to restore normal blood cell formation. Solid tumors often spread to the bone marrow, causing complications and a poor prognosis. Tumor cells enter the marrow through blood vessels and disrupt the normal environment, allowing them to survive and invade. They also induce new blood vessel formation and immune evasion. Studying this process can help develop better treatments. Cytogenetic abnormalities in hematological malignancies are important for understanding disease development, prognosis, and treatment. Structural and numerical changes in chromosomes can be identified through cytogenetic analysis, allowing for precise diagnosis and personalized therapies. Advanced techniques like FISH and NGS have improved detection of genetic abnormalities. Advancements in molecular genetics have greatly enhanced our understanding of the genetic basis of hematological disorders. By unraveling the intricate web of genetic aberrations underlying these conditions, researchers have identified novel therapeutic targets and developed targeted therapies. In hematological disorders, such as leukemia, lymphoma, and myeloproliferative neoplasms, genetic mutations contribute to the dysregulation of cellular processes, including proliferation, differentiation, and apoptosis. Key genes involved in these disorders include oncogenes, tumor suppressor genes, transcription factors, and genes encoding proteins involved in signaling pathways. Molecular genetic techniques, such as polymerase chain reaction, PCR, and DNA sequencing, enable the detection of specific mutations, gene fusions, and polymorphisms associated with hematological disorders. These techniques play a critical role in diagnosis, classification, and risk stratification, influencing treatment decisions and patient outcomes. The growing understanding of molecular genetics in hematological disorders emphasizes the need for interdisciplinary collaborations between pathologists, hematologists, and molecular geneticists to translate this knowledge into improved clinical care. Flow cytometry and immunophenotyping are essential in diagnosing and classifying blood disorders. In flow cytometry, cells are labeled with fluorescent antibodies and analyzed using lasers to identify different cell types. Immunophenotyping examines cell surface markers to determine disease markers and guide treatment. These techniques, combined with genetics and cytogenetics, enhance diagnosis and patient care in hematology. In the 6th Evaluation of Bone Marrow Aspirate Smear section, we examine bone marrow aspirate smears to diagnose and monitor hematological disorders. We collect marrow from the pelvis or sternum, stain slides, and analyze cellular morphology using light microscopy. This helps identify abnormalities and classify disorders like leukemia and myelodysplastic syndromes. Despite its subjectivity, this evaluation is crucial in hematological diagnostics. In summary, hemoglobinopathies and thalassemias are inherited disorders that affect the production or synthesis of hemoglobin. They can result in abnormal red blood cell morphology, increased hemolysis, ineffective erythropoiesis, and varying degrees of anemia. Diagnosis involves laboratory tests to establish a precise diagnosis and guide management strategies. Myelodysplastic syndromes, MDS, and secondary leukemias are hematopoietic disorders characterized by ineffective maturation of blood cells, abnormal bone marrow morphology, and an increased risk of developing acute myeloid leukemia. Diagnosis involves evaluating blood and bone marrow samples to guide treatment decisions. Bone marrow transplantation is a curative treatment for various blood disorders. It involves infusing healthy stem cells into the patient to replace diseased cells. Success relies on matching donors, conditioning therapy, and post-transplant care. Complications like graft versus host disease and infections are closely monitored. Systemic diseases present with diverse hematological manifestations. Autoimmune disorders can cause anemia, thrombocytopenia, and autoantibodies affecting different cell lines. Infections like HIV can cause cytopenias and immune dysregulation. Hematological malignancies may present with lymphadenopathy or hepatosplenomegaly. Hemostasis, the regulation of blood fluidity and prevention of bleeding, is disrupted in bleeding disorders or thrombotic complications. Coagulation disorders affect platelets, clotting factors, or blood vessel lining. Diagnosis and monitoring rely on assessing coagulation parameters, while tailored treatments involve replacement therapies or anticoagulant agents. Therapeutic anticoagulation prevents thrombotic complications with an understanding of the coagulation cascade and anticoagulant drugs. Molecular targeted therapy has revolutionized the treatment of hematologic cancers. Specific inhibitors and antibodies have improved outcomes in leukemia and lymphomas, while CAR T-cell therapy has shown remarkable efficacy. Ongoing research aims to identify new targets and develop innovative therapies to further improve patient outcomes. In summary, histology aids in understanding the complex mechanisms of hematological disorders. Techniques like flow cytometry and molecular genetics improve diagnosis and personalized treatment. Recognizing systemic disease manifestations and maintaining hemostasis are important. Molecular targeted therapy has revolutionized hematologic cancer treatment, leading to better patient outcomes.